health and addictions program is a large program that encompasses many aspects, one of them being our acute inpatient unit, and other services that are provided include residential treatment for young people on a longer term stay basis, outpatient services, and crisis services. There are many disciplines at the IWK Mental Health and Addictions program. We have a combination of psychiatry, psychology, social work, nursing, occupational therapy, child life. Those are just to name a few. The policies and procedures within our mental health and addictions program are designed and reviewed regularly. They're designed by our staff in combination with staff in our quality improvement department here at the IWK. So we have a very robust system of review for our policies and procedures. So we have a fairly detailed process which involves constant quality review and quality improvement. All of the parts of our system are integrated together. Patients and families, they travel between different aspects of our services. For example, if someone's on our inpatient unit, they would get follow-up care likely in one of our outpatients or our residential or day treatment services. So all of the services are integrated together. Partnerships are really important for our young people and their families. We often have our young people going out to services in the community, such as Lang House, and also we would have those services coming in and providing help for our young people while they're on our units. If a youth feels that they have a problem with their mental health, they should be calling into our central referral line. That would be the first place that they would call. If it's a critical issue or an urgent issue, they could call into our crisis service or arrive at our emergency department. If they are concerned at home, the family is concerned about a young person, they can call our mobile crisis service as well. We have multiple ways to intake young people into our services.
If a youth is feeling suicidal, the best thing to do is for them to talk about those feelings with someone they trust. That would be the first thing that they should think about doing. That can be a parent, an older brother or sister, other relatives, teachers, guidance counselors, coaches. If they don't feel that they could talk to someone, or if the feelings get worse, then they can call the kids' helpline, they can call mobile crisis, or they can come to our emergency room.
The first thing that a family should do if they're concerned about their young person having a mental health issue is to talk to the family doctor. Most of the referrals that we receive within our mental health and addictions program come through that source. So often it would be a family physician. Sometimes it comes through the school system, so a problem would be identified or an issue identified in the school system, and there would be guidance counselors or school professionals who would actually help facilitate a referral into our system.
If a family member or friend is worried that someone they know is suicidal, there are a couple of things that they should remember. First of all, they should actually talk to that person. Sometimes people are afraid if they talk to the person that they'll put ideas in their head. But most of the time what happens is that the person is relieved. And so you should talk to the person and ask them if they're feeling suicidal, and ask them if they've thought about how they would do it, if they've been thinking a lot about it, and if any of those answers are yes, they should definitely seek help for the person that they know.
Stigma is an important issue in mental health care. Stigma often prevents people from coming to the emergency department, from seeking help. Young people don't want to be perceived to be crazy. That label that gets attached to them in their peer groups and in their family groups is really a serious issue for them. And so stigma mostly prevents people from seeking help and or sometimes staying in the services that are going to be beneficial to them. So it's very important in our society that we break down those barriers and that we understand mental illness as a similar problem to physical illness, and that there should be no more stigma attached to having a mental illness than there is to having diabetes. And that's our goal into the future.
So we have a very clear vision for mental health care for children and adolescents in the province of Nova Scotia. Much of that vision is articulated in our 2011 to 2016 IWK Health Center Mental Health and Addictions Program Strategic Plan, which was 2 years in the making. Central features of that are that we will have all of our therapies and our approaches to interventions be evidence-based, or when there's insufficient evidence, evidence-informed. Evidence-informed means that we are constantly reviewing scientific literature and examining whether or not we're meeting those standards in carrying out the care that we give to children and adolescents. Another critical feature is that we want, by the end of 2016, to have very acceptable wait list and wait times, and we're already on our way to improving that dramatically. And a final piece is that we will be well embedded as the IWK within the local community in terms of collaboration with other agencies who also care for children and adolescents, and in terms of the larger community of Nova Scotia, where we are partnering and building capacity for all sorts of care that we know about and spreading it throughout Nova Scotia.